If you've ever seen an ad that says something like, boost your testosterone 300% naturally, while a shredded guy rips his shirt off, and you've thought, do these things actually work? Or is this just expensive hype? You are not alone. A lot of men in their 20s, 30s, and 40s are tired, stressed, not feeling as strong or driven as they used to, and the internet is very eager to tell you that a pill can fix all of that. In this video, we're going to strip away the marketing and talk about the truth. What is testosterone actually doing in your body? What does low T really mean? Do over-the-counter testosterone boosters work at all? Which ingredients have some evidence behind them, which are basically snake oil? And what actually moves the needle in a meaningful way? Most importantly, by the end, you'll know what's worth your money, what's worth your effort, and what probably isn't. And just so we're clear, I'm not here to sell you a supplement. I don't have a discount code or a #1 booster to push. This is not personal medical advice, it's general education. If you suspect you have low testosterone, please see a qualified healthcare provider, get proper testing, and make decisions with them, not just based on a YouTube video. Let's start with the basics. What is testosterone and what does low actually mean? Testosterone is a hormone your body makes, mainly in the testicles if you're male, and in smaller amounts in the ovaries and adrenal glands if you're female. In men, it plays a big role in puberty changes, deeper voice, facial and body hair, increased muscle mass, sex drive, and sperm production. In adult life, it helps support muscle maintenance, bone density, red blood cell production, mood, energy, and sexual function. But testosterone isn't just high or low, it exists on a spectrum and it naturally fluctuates. Levels are typically highest in the morning and lower later in the day. They can change with sleep, stress, illness, diet, weight, and even how much you've been lifting. Lab normal ranges vary by lab, but for adult men, total testosterone is often considered normal somewhere around 300 to 1,000 nanograms per deciliter. That's a big range. Some guys feel great at 350, others feel terrible at 350 and feel normal at 600. There's individual variation. When doctors talk about low T, they usually mean two things together: consistent, clearly below normal testosterone levels on blood tests taken early in the morning on at least 2 separate days, plus symptoms that fit, like low sex drive, erectile issues, low energy, loss of muscle, depressed mood, and sometimes loss of body hair or reduced shaving frequency. Just feeling tired or not having a six-pack is not proof of low testosterone by itself. Here's where things get tricky. A lot of the symptoms that are blamed on low T, fatigue, low motivation, weight gain, brain fog, can also be caused by sleep deprivation, stress, depression, poor diet, lack of exercise, too much alcohol, or other medical problems like thyroid disorders or sleep apnea. But the supplement industry doesn't make money by telling you to go to bed earlier and manage your stress. It makes money by convincing you that your problem is low T and selling you a solution in a bottle. So what exactly are testosterone boosters? The phrase usually refers to over-the-counter supplements, capsules, powders, gummies, that claim to raise your testosterone naturally. They're sold as herbal formulas, natural anabolic support, or male vitality products. They're very different from prescription testosterone replacement therapy, or TRT, which is actual testosterone given by injection, gel, patch, or pellets under medical supervision. TRT absolutely can raise testosterone levels, often dramatically, but it also shuts down your own production and has real risks and side effects. That's a separate conversation. Today, we're focused on the boosters you can buy without a prescription, the ones with intense marketing, dramatic before and afters, and long ingredient lists. The question is, do those over-the-counter boosters actually raise testosterone in a way that matters? The short, uncomfortable truth is this. For most healthy men with normal testosterone levels, the vast majority of testosterone boosters do not meaningfully raise testosterone or change your life in the way ads suggest. Some ingredients can help if you're deficient in something. A few herbs have small studies showing modest increases in certain groups, but we're usually talking about small bumps, often still within the normal range, and not the night and day transformations you see in marketing. Let's walk through the main categories of ingredients you'll see and what we actually know about them. First, the basics. Vitamins and minerals. Many boosters contain zinc, vitamin D, magnesium, and sometimes boron or B vitamins. These are not magic testosterone drugs, but they are involved in hormone production and overall health. Zinc is essential for testosterone production and sperm health. Severe zinc deficiency can absolutely lower testosterone, and correcting that deficiency can bring levels back to normal. But here's the key. If you're not deficient, taking extra zinc on top of normal levels does not keep pushing testosterone higher and higher. Your body has regulatory systems. Too much zinc over time can actually cause problems like interfering with copper absorption and affecting your immune system. Vitamin D is more like a hormone than a typical vitamin and is involved in many processes, including hormone regulation. Some studies have shown that men with low vitamin D who supplement back to normal levels see small increases in testosterone. Again, that's correcting a deficiency, not supercharging you beyond your biological baseline. If your vitamin D is already fine, megadosing it won't turn you into a different person, and too much vitamin D can be harmful. Magnesium plays roles in muscle function and many biochemical reactions. A few small studies suggest that in people who are magnesium deficient or very physically active, supplementing magnesium may support normal testosterone levels. But as with zinc and vitamin D, the real benefit is in fixing a deficiency, not stacking more on top of normal. So one real takeaway already. If your diet is poor and you're deficient in key nutrients, fixing those deficiencies may help your testosterone come back up into your natural healthy range. That's legitimate, but that's not a booster in the sense most ads are selling. It's basic nutrition and health. Now, let's talk about the sexy herbal ingredients, the ones plastered on labels and hyped in ads. Ashwagandha is one you'll see a lot. It's an herb used in traditional Ayurvedic medicine, often marketed for stress, anxiety, and male vitality. There are some small studies suggesting that ashwagandha can reduce stress and cortisol, and in some men, especially those under heavy stress or with fertility issues, it's been associated with modest increases in testosterone. In a few trials, infertile men saw their testosterone levels rise and sperm parameters improve while taking ashwagandha. In healthy, young resistance-trained men, results are more mixed, but there is some evidence of small testosterone increases and perhaps better strength gains when combined with training. So is ashwagandha total nonsense? Not exactly. It may help some people, especially if stress is a major factor in their life. But again, we're talking about relatively small changes, and study quality varies. It's not going to take you from 300 to 900 and transform your physique on its own. Fenugreek is another popular one. Some studies have shown that certain fenugreek extracts, especially when combined with resistance training, can lead to small increases in testosterone and improvements in strength and body composition in men, but often within the normal range and sometimes without huge changes in blood levels. Other studies show more impact on libido and subjective feelings of well-being than on actual measured testosterone. Overall, fenugreek might have some mild effects in some men, but it's not a guaranteed dramatic booster. Tongkat Ali, also known as long jack or Uricoma longifolia, has become trendy lately. A few small human studies suggest that it may improve libido and, in men with low or borderline low testosterone, raise levels somewhat toward the mid-normal range. There's also evidence it may help with stress and tension. But here's the caution: most supplements aren't tightly regulated. The amount and purity of Tongkat Ali in different products can vary wildly, and long-term safety data in large populations is limited. It's not a magic bullet, and you need to be careful about product quality. Tribulus terrestris is a classic test booster ingredient that's been around forever. It's heavily marketed as a natural bodybuilding aid. But when you actually look at the research, most well-designed human studies show little to no significant increase in testosterone from Tribulus in healthy men. It might increase libido in some people, but that doesn't necessarily mean it's raising your testosterone meaningfully. In terms of blood levels, the evidence is weak. D-aspartic acid, or DAA, had some early buzz after a small study suggested it might increase testosterone in men with low baseline levels. But follow-up research, especially in healthy resistance-trained men, has been disappointing, with many studies showing no boost or even slight decreases at higher doses. The initial hype didn't really hold up. There are other ingredients you'll see: maca, horny goat weed, ginseng, boron, nettle root. Maca, for example, may improve libido for some people, but it doesn't consistently move testosterone levels. Horny goatweed contains a compound that may mildly affect blood flow, more like a natural, very weak cousin of ED medications, but it's not a true testosterone booster. Boron can slightly increase free testosterone in some studies by lowering sex hormone-binding globulin, but the effect size is small, and long-term safety at higher doses isn't well established. So if we zoom out, what's the honest bottom line on most over-the-counter boosters? 1. If you're deficient in basic nutrients like vitamin D, zinc, or magnesium, correcting that can help bring your testosterone into a healthier range. But you don't need an expensive testosterone stack for that. A simple, well-dosed standalone supplement under a doctor's guidance or better nutrition can do the job. 2. A few herbs like ashwagandha, fenugreek, and tongkat ali have some evidence for modest testosterone increases or improved libido, especially in stressed, older, or subfertile men, but the changes are usually small and study quality is mixed. They're not nonsense, but they're also not miracles. 3. Many heavily hyped ingredients like tribulus and D-aspartic acid have little solid evidence of meaningful testosterone boosting in healthy men, despite big marketing claims. And 4. Even when a booster does raise your testosterone on a blood test, the increase is often modest, like going from low normal to mid-normal, and it's not guaranteed that you'll feel a huge difference in energy, muscle, or mood. Now, there's an even bigger issue we need to talk about: safety and regulation. In most countries, including the US, dietary supplements are not regulated like prescription drugs. Companies don't have to prove that their product works before selling it, and quality control can be all over the place. Independent lab analyses have sometimes found that natural testosterone boosters contain things that aren't on the label, including unapproved drugs, anabolic steroid-like compounds, or other substances that can stress your liver and cardiovascular system. That means 2 things. First, you can't fully trust every label. Second, if a supplement actually has a strong steroid-like effect, that might be a red flag that it's spiked with something that's not legal or safe, not that the herb itself is that powerful. There have been cases of liver injury linked to certain testosterone booster products. You do not want to trade a tiny chance at a small hormone bump for real damage to your organs. On the flip side, if a product is truly just vitamins, minerals, and herbs in reasonable doses, the safety risk is usually lower, but the effect is also likely to be modest. So you're looking at a trade-off. Either it's pretty safe and not that powerful, or it's powerful because it's doing something closer to a drug and might come with drug-like risks. That's worth thinking about. So where does this leave you if you're a guy in your 20s, 30s, or 40s feeling tired, weaker than you used to, or not as interested in sex, and you're tempted by these boosters? Here's a more grounded approach. First, ask yourself some hard questions about your lifestyle before you assume your problem is low testosterone. How many hours a night are you sleeping? Honestly, are you getting 7 to 9 hours most nights, or are you running on 5 or 6 and caffeine? Chronic sleep deprivation can significantly lower your testosterone levels and wreck your energy, focus, and mood. What's your weight and waistline doing? Carrying a lot of excess fat, especially around your abdomen, is strongly associated with lower testosterone. Fat tissue can convert testosterone into estrogen, and obesity is one of the most common reversible causes of low testosterone in men. How much do you move? Regular resistance training, lifting weights, or doing body weight strength work, plus some cardio is a powerful natural stimulator of testosterone and growth hormone. On the other hand, being completely sedentary or doing extreme excessive endurance exercise without enough recovery can suppress your hormones. How much alcohol are you drinking? Regular heavy drinking can lower testosterone and impair testicular function. Chronic stress, high anxiety, and depression can also influence your hormonal environment and your perception of energy and libido. If you're sleeping 5 hours, sitting all day, barely exercising, drinking a lot, eating low-quality food, and then hoping that a capsule will fix your testosterone, you're setting yourself up for disappointment. No booster replaces the basics. In fact, for many men, fixing those basics will do far more for their testosterone than any supplement. Second, if you truly suspect low testosterone, get tested properly before you start experimenting with boosters. That means seeing a real healthcare provider, preferably someone comfortable with male hormone health, a primary care doctor, endocrinologist, or urologist. Ask for an early morning total testosterone level between about 7 and 10 a.m. when levels are highest. If it comes back low or borderline, it should usually be repeated on another day to confirm. In many cases, it also makes sense to check other labs: free testosterone, sex hormone-binding globulin, luteinizing hormone, follicle-stimulating hormone, prolactin, thyroid function, maybe blood counts and metabolic markers. Why does this matter? Because if your testosterone is genuinely low, there might be a specific underlying cause: obesity, medications, steroid use in the past, testicular injury, pituitary problems, sleep apnea, chronic illness. Treating that underlying cause directly often helps more than any supplement, and if you do eventually consider TRT, you want to do that with a full picture of what's going on, not blindly. Third, be cautious about using boosters instead of real medical evaluation. If you have symptoms of low T and you just keep cycling through natural stacks without ever getting your blood checked, you might be delaying diagnosis of something important, like diabetes, a pituitary issue, or severe sleep apnea, while you throw money at powders. Now, to be fair, could there be a place for certain testosterone-supporting supplements? Possibly in specific situations. If you've had blood work showing you're low in vitamin D, correcting that deficiency is smart for many reasons, including potential hormone support. If your diet is limited and you might be low in zinc or magnesium, targeted supplementation under guidance can help. If your stress is through the roof and you're working on sleep, therapy, and lifestyle, and you want to see if ashwagandha helps you feel a bit better, that might be reasonable, as long as you choose a reputable brand and clear it with your doctor, especially if you take other medications. But the key word there is support. These are not replacements for sleep, nutrition, movement, and actual medical care when needed. They're not magic shortcuts. What about prescription testosterone, TRT, as a kind of ultimate booster? Testosterone replacement therapy absolutely works to raise testosterone levels. For men with true hypogonadism, real, persistent low testosterone with clear symptoms and no easily reversible cause, TRT can be life-changing. It can improve libido, energy, mood, body composition, and bone density. But it is not something to jump into lightly, especially if you're younger and still want children. When you take external testosterone, your brain senses high levels and reduces its own signals, LH and FSH, to your testicles. Over time, your testicles can shrink, sperm production can drop, and fertility can be seriously impaired. That's why guidelines are very cautious about putting younger men with borderline levels on TRT just for optimization, especially if they haven't had a full workup. TRT also has potential risks: thickening of the blood, which can increase clot risk, possible effects on prostate health, acne, sleep apnea worsening, and more. It requires regular monitoring, blood tests, exams, dose adjustments. It's not a casual hack. It's a medical treatment that should be reserved for men who truly need it and who are under careful supervision. So if we come back to the original question, the truth about testosterone boosters, do they actually work? Here's the most honest answer I can give you. Most over-the-counter testosterone boosters do not do what the marketing implies. They do not take an average, reasonably healthy guy and turn him into a dramatically more muscular, driven, sexual version of himself. Some of them might nudge your testosterone up a bit on a blood test, especially if you're starting low or missing key nutrients. A few herbs may slightly improve stress, libido, or sense of well-being for some people, but they are not magic. The things that reliably make the biggest difference to your testosterone and how you feel are not glamorous, and they don't come in a bottle. They are getting enough quality sleep consistently, maintaining a healthy body weight and waistline, doing regular resistance training and being physically active, eating a nutrient-dense diet with enough protein, healthy fats, and micronutrients, managing chronic stress and addressing mental health, limiting heavy alcohol use and not smoking, treating medical issues like sleep apnea, diabetes, or thyroid disorders. If, on top of that foundation, you want to fine-tune with carefully chosen, evidence-informed supplements that can be reasonable. But if you skip the foundation and only chase the boosters, you're going to be spinning your wheels. If you're still with me, here's a simple way to move forward. If you're worried about your testosterone, step 1 is not ordering the latest stack. Step 1 is getting a checkup. Talk to your doctor honestly about your symptoms. Get your morning testosterone measured, ideally twice. Ask about other possible causes of how you feel. If your levels are normal and your lifestyle is rough, you have your answer. Start with the basics. If your levels are low, dig deeper into why, and then discuss legitimate options, which may include weight loss, treating underlying issues, or, in carefully selected cases, TRT. As for boosters, if you're going to use anything, be selective. Look for products from reputable companies that do third-party testing. Avoid anything that sounds too good to be true, promises insane muscle gains without training, or feels like a designer steroid in disguise. Be wary of massive proprietary blends where you can't tell how much of anything you're getting. And always let your healthcare provider know what you're taking, especially if you have other conditions or take medication. I'd like you to walk away from this video with one core idea. Your hormones are not separate from your lifestyle. Testosterone doesn't live in a vacuum. When you improve your sleep, nutrition, movement, and stress, you're not just being healthy in some vague way. You're literally changing the signals your brain and testicles are exchanging. You're creating an internal environment where your natural testosterone can be as strong as your genetics allow, without you needing to gamble your health on unproven pills. If you feel comfortable sharing, let me know in the comments. Have you ever tried a testosterone booster? What did you notice, if anything? And after hearing this, what's one concrete change you're willing to focus on for the next month to support your hormones naturally? Whether that's going to bed 30 minutes earlier, lifting twice a week, cutting back on alcohol, or finally booking that blood test. If you want more clear, no-drama breakdowns of men's health topics that are usually surrounded by hype and confusion, consider subscribing. My goal is to help you make informed decisions about your body based on what we actually know, not on what's easiest to sell. Take care of yourself. Seriously, your energy, your mood, your strength, your sex life, they're all connected. You deserve the real story, and you deserve to feel as good as your body is capable of feeling.